I'm Pat Doris. So good to see you here. Welcome to The Story. All the ways to communicate with us right there at the bottom of your screen. You can email us. The address is thestory@kgw.com, or use the hashtag TheStoryKGW on Twitter, or leave us a voicemail. You can call our phone number 503-226-5090. This week we're talking about the addiction crisis in Oregon and Washington. Tonight, let's zero in on fentanyl. As we've been reporting, the use of fentanyl has increased dramatically in the past decade. Nationally, fentanyl is killing people at an unprecedented rate. 66% of overdose deaths in 2021 were related to that drug, according to the CDC. And today, the Drug Enforcement Agency declared the first ever National Fentanyl Awareness Day. Health officials are now saying that if you're taking drugs that you got anywhere other than a pharmacy, you should assume they contain fentanyl and take precautions. It's possible that you know someone who either does drugs or is at risk of becoming a drug user, your kids, their friends, people in your community. And while not using them is the best answer, addiction's complicated, and ignoring the issue is a bad idea. Some health experts say if users are going to take drugs, it's important to make them as safe as possible, especially when it comes to fentanyl. We talked today with Kelsey Young, a harm reduction supervisor for Multnomah County.
Harm reduction has shown to increase access to treatment up to 5 times. So for someone who's coming into a syringe exchange program regularly, they're 5 times more likely to end up in treatment than someone who is using and is not engaged in any kind of harm reduction. So what we do know is that having that support and non-judgmental approach to engaging with people is beneficial to their health outcomes.
Harm reduction means that instead of sending drug users to jail, they're provided ways to use drugs in a safer environment. That could be needle exchanges to prevent blood-borne diseases, or in the case of fentanyl, supplying Narcan and then fentanyl testing strips. Narcan is a nasal spray that you can get at the pharmacy. It reverses an opioid overdose. Some health insurances do cover the cost. You can also get it from a harm reduction clinic. There are several throughout Oregon, and there's an ongoing effort to get Narcan into the schools. Fentanyl testing strips can tell if the drugs you're using contain fentanyl. It's not a perfect system. It works better for some than others, but Young says it is a good place to start.
You're going to pull out a small strip that looks like this. And what you want to do is dilute whatever substance you're using into some water. So it's about 1 teaspoon of water along with about 50 milligrams of the substance. And you're going to mix that into, you can use one of the little tins that we provide or a bottle cap of some kind. And then you're going to be dipping this strip into it. When you do that, if there is fentanyl present, you're going to get a result with 1 red line like this, and that will tell you that fentanyl is present in that sample that you just tested.
You can get fentanyl test strips at harm reduction clinics throughout the county. They're also available, they're not available, in pharmacies, but you can get them online. And one more thing, whether you use drugs or not, be aware of the signs of an overdose. It only takes a few milligrams of fentanyl to kill a person. It's about the size of a few grains of salt. When someone is overdosing, they stop breathing, so they get limp. Their skin turns pale or blue, especially their lips and fingertips. They might lose consciousness or vomit or foam at the mouth. If any of that happens, you need to call 911 immediately. And if you have it, use Narcan. Oregon also has a Good Samaritan law. That means that you will not be prosecuted if you seek medical help for someone who's overdosing. Young says harm reduction, like the fentanyl test strips, is a better approach than putting people in jail.
We understand that this country has taken an approach to criminalizing substance use, and in the past 50 years, what we have seen is that the war on drugs and the approach of criminalization of substance use has not stopped the increase of substance use in our country. So we believe that taking the approach of empowering people to have tools to reduce their risks, as well as meeting them with respect and support gives them the opportunity to explore avenues for decreasing their use, using safer, and possibly getting into treatment so that they can stop substance use.
If you or someone you know needs help finding treatment, a good place to start is the Alcohol and Drug Helpline with Lines for Life. That number is 1-800-273-8255. So how did we get here? Fentanyl deaths started to rise sharply around 2013. According to the Drug Enforcement Administration, fentanyl does have legitimate medical uses as a painkiller, but it has to be closely monitored by healthcare workers. Illicit fentanyl is made into counterfeit prescription pills or mixed in with other drugs. It poses a huge danger to people who take it and don't know what the dose is.
Anyone who gets pills from anywhere other than a pharmacy should assume that they are counterfeit and contain deadly amounts of fentanyl.
Even a small amount can be deadly. Just 2 milligrams can kill a person.
You never know which pill is going to have a deadly dose versus those that don't have a deadly dose.
In 2016, Portland State University football player Kyle Smith died of a fentanyl overdose. He was an offensive lineman who played 3 seasons with the Vikings before he died. Also in 2016, music legend Prince was killed by an overdose of the drug. That year, the Center for Disease Control announced that for the first time, fentanyl had overtaken heroin as the country's deadliest drug. But fentanyl use really skyrocketed last year during the COVID-19 pandemic. The CDC says overdose deaths from synthetic opioids like fentanyl rose 55% in 2020. That's the biggest single-year increase ever.
When we're looking at the COVID pandemic and all those factors coming together at the same time, I think maybe something close to a perfect storm.
In 2021, the Beaverton School District announced several of their students had died from fentanyl overdoses in the previous 2 years.
Drug dealers have figured out a way to reach out to the kids, and they're doing it again and again and again, and these kids are seeing it.
In 2018, law enforcement in Oregon seized only 690 fentanyl pills. The next year, that number rose to more than 102,000 pills. Then in 2020, they seized more than 734,000 pills.
Fentanyl has, I won't say overnight, popped up, but it's come into our community very quick.
And that is how we got here. As I mentioned, Narcan can be used to reverse the effects of an overdose and save someone's life. It's something that a lot of first responders carry with them. Mark Salinger from our sister station in Denver has a look at that life-saving work in action.
Seconds do matter when it comes to some of these things.
Seconds count. Somebody stops breathing.
As hope fades, seconds pass.
Take control, sir!
Fast.
Sir!
Too fast.
Sir!
Going to the other side.
Capital 9 Baker 1, can you start medical? I'm going to be doing Narcan.
Hello?
Hi, can you hear me?
Yes, I need an ambulance quickly. I came back to my friend's apartment and she's like overdosed. She's not breathing.
Sir, I have help on the way.
Okay.
On this call,
I was right down the street, maybe a block away.
Arapahoe County Sheriff's Deputy Chris Calderon Calzada responded in less than 3 minutes.
I knew the building, was trying to figure out where the apartment was.
No, I need you to just talk to me. Don't worry about the
They're at the door, I think. Hold on.
Okay, go ahead.
Take a 5 at the door.
An overdose.
Sheriff's office!
Another overdose. This time, inside a home.
Hey, where's she at? She's lying on the ground.
The woman lies unconscious near her kitchen.
White female, not conscious, not breathing for Baker 5-2.
Her arms limp and her hands blue.
Hey. Seeing them unconscious and seeing somebody who's not breathing is always going to get your adrenaline up. Because you want to do everything you can to help that person. They have family members that care for them. They have loved ones. They might have kids. So you want to do everything you can to help them start breathing again so their loved ones have another day with them. Just like I want my family members to have another day with me or vice versa.
Chris searches for time more often these days.
What did she take?
She was drinking and she took one of the blue pills.
What blue pill?
The blues, the fentanyl pills that they're all taking nowadays.
Desperate for precious seconds to save a life.
Hope I did the right thing.
People will use something thinking it's something else, and if it's laced with fentanyl, you'll see a very quick overdose.
Boulder Police Deputy Chief Stephen Redford saw his officers respond to nearly double the number of overdoses from 2020 to 2021.
Did he take anything?
I think he was smoking fentanyls.
For all intents and purposes, a lot of times a person is clinically dead, whereas they have no pulse, no breathing.
Fentanyl leaves little time before an overdose turns into a death.
Thank you guys for getting here quick.
Naloxone, or Narcan as some people know it, reverses the effects of the drugs.
253 Narcan deployed.
It's one of the tools that our officers won't leave the station without when they head out on their shift.
You don't want this person that you're there to help to die. So you're trying to do everything you can with what resources you have to help them.
Hope I did the right thing.
Baker 5-2 Narcan administered.
This was the 7th time Deputy Calderon Calzada used Narcan last year.
Yeah, her face was completely blue. Her lips were blue.
Baker 5-2, I'm starting compressions on all the pulse.
These are the seconds that matter most.
Hey. Hey, you okay? 5-2 out of the pulse again.
That pulse was hers.
I died. I was dead. I know not everyone believes in God, but it was a miracle of some sort. That was something. It was a miracle.
The woman he saved on that December afternoon in Arapahoe County.
He's an angel. Angel in a uniform.
Asked us not to show her face or say her name.
But this was a reality that I truly died. I was just thinking about what my dad would do, how he would feel.
She knew the pill she had was laced with fentanyl.
Hey, wake up.
The decision to take it was fueled by decades of addiction.
What did you take?
I'm scared.
I get it that you're scared. I just had to give you Narcan.
I was obviously searching for the next high. So that was what was available, and I was willing to try it. It eats your soul up. It absolutely eats your soul.
Sir, you gotta wake up! Come to us, come on, come to us, sir. You're right, come on. Come on, boss. Come on, you're okay. There you go. Keep breathing. There you go. You just relax. I had to do 2 Narcan on you.
In the moments when there's still hope.
She's alive, so that's all that counts.
Lives change in seconds.
Come on.
No, I'm fine.
No, you're not. You just died.
It makes me feel better knowing that she's doing better now. At least I had my part in helping her get to where she's at now.
You only see it on movies.
Her wallet and her ID.
I just made a real life movie right there. That's reality right there. It's not just the movies. That just happened.
Wow. That was Mark Salinger reporting. A lot of the illegal drugs on our streets today are fentanyl, according to law enforcement. Last night we talked with a sheriff's sergeant who believes the passage of Measure 110, which made Oregon the first to decriminalize small amounts of hard drugs, the first in the nation, that Measure 110 is responsible for a lot more drugs on our streets. We asked for your comments, and some of you disagreed with what he had to say.
I'm glad the police are going after these large organizations that are bringing all the drugs in, but they would be bringing all the drugs in whether or not Measure 110 was in place.
Lee also weighed in, writing Measure 110 prevents jailing people who possess small amounts of drugs. Research shows jailing these folks does absolutely zero to get them off drugs long term. The same is true for forced treatment as opposed to voluntary treatment. Others agreed with him.
It's pretty easy, but it's not as easy as that policeman's making it out to be. I think he was kind of real one-sided with the whole thing. Treatment is the way to go.
But still others took the opposite approach. Doug wrote in, Measure 110 is just another Oregon first on untried solutions and last on adopting the tried and true. And Bill added, from increased cartel business to more homelessness and discarded needles, this is an ill-conceived experiment, as they called it in the beginning. And Eleanor suggests an approach to try, offer free treatment, but let the adult addicts have their drugs for free. That will really cut the crime rate. No more burglaries or robberies to get the money to buy drugs. Thanks for all your comments, and please do keep them coming. We have a robust discussion going on with this one. Okay, enough of the gloom and doom. Let's talk about real progress toward solving Portland's homeless crisis. More than 100 new housing units just opened up for low-income families.
It provides families long-term stability in a quality building with services that they need to help they and their children thrive.
And there are more affordable homes being built as we speak. When the story continues. Welcome back. Keep sending your questions and comments to the story at kgw.com or give us a call and leave us a voicemail at 503-226-5090. Well, here's that good news that we promised you. More affordable housing is coming to Southeast Portland. Today is the grand opening of Crescent Court Apartments. That's more than 100 new units for low-income families. Some of the apartments are meant for those currently living on the streets, while other units will be for families who make 30 to 60% of the area median income. Monthly rents are going to range from about $300 to $1,400, and the units for people experiencing homelessness are funded through the Metro Supportive Housing Services measure. Blair Best joins us from the property. And Blair, this is all part of Portland's housing bond passed by voters in 2016. How many affordable housing units have opened so far through this bond, and how many more are planned?
So, Pat, so far 3 buildings have opened. That's including Crescent Court here behind me. 4 more are scheduled for later this year, and another 4 are scheduled for next year. Now, it's also important to note, Pat, that a handful of these buildings are brand new construction.
So some of them are remodels, I guess. But Blair, what happens if some of the residents who are living there struggling with addiction or mental health issues? What if they have those? Is there anyone there that can help them out?
So yes, Central City Concern, one of the leaders of this project, they'll be offering on-site social services for residents struggling with mental health issues or even struggling to pay rent. And the Portland Housing Bureau says it's a small solution to a much bigger problem.
It makes a huge difference for those individuals and households that are able to come off the street and into shelters and into this housing.
Now, even on top of all these social services, Pat, children will also have a space to go after school to receive free care.
Wow, that sounds pretty good. So when can people apply to move in, and what does that process look like?
So we're told that residents started moving in today, and people can apply for one of these units through an online application. We have much more information on how to go about doing that on our website, kgw.com.
All right. Thank you, Blair Best. Appreciate it. Remote learning was difficult for a lot of kids, but even harder for special education students. And now, as they're trying to get caught up, Portland Public Schools is thinking about cutting more than 24 special ed staff. When the story continues. Some Portland parents with kids in special education have concerns about whether their child's needs were met during the pandemic, and now they're worried next year's proposed budget could mean even less support in the classroom. Christine Pitawanich explains.
A Portland Public Schools spokesperson says student enrollment is projected to go down next year, and that also means fewer staff. But they also say student-staff ratios will not be going down. Still, the possibility of fewer people in classrooms has some educators and parents worried.
These proposed cuts are a bad look for each and every member on this board and PPS as a whole. Thank you very much for your time. Thank you.
That is Angel Courtney speaking at a Portland Public School Board meeting last week.
This affects not only my child, but all the future generations of at-risk special needs children.
The Portland Association of Teachers says information from the district shows 26 fewer licensed special education staff in classrooms next year if the proposed budget is approved. Courtney says cuts like that won't help children like her son, 16-year-old Kale, who struggles with a rare genetic disorder similar to autism.
It affects his speech, his fine motor control. His disorder also comes with an array of behaviors, which could be hitting, throwing.
She says her son's needs are already not being met, in part because there's just not enough staff. She says special ed needs more resources, not less.
There just isn't enough funding as it is. It's already hanging on by a thread. It makes me want to cry.
And to hear that even though the number of special education students from this year to next is going to be flat, that we are losing staffing in multiple schools is absolutely heartbreaking.
The possibility of cuts is also weighing on educators like Mary Darren, who works in special education.
I am a speech language pathologist with Portland Public Schools. I have been with Portland Public for 9 years.
I'm Nathan Earl, and I am a licensed clinical social worker working as a mental health professional in Portland Public, and I've been a Portland Public employee for 5 years now.
They, like so many others, say student need is off the charts, and right now, there's not enough staffing to meet their needs.
This year has been incredibly hard. Special educators are leaving the field, and yet next year we're expected to do it all with less.
To hear that we're considering removing supports from a system that is in such great need is really creates a feeling of panic, honestly.
Nathan Earl says his elementary school has lost a number of paraeducators, people who work closely with special education students.
In the school that I work in, we are on paraeducator number 7, who is going to be leaving.
It honestly scares me for the future of special education, because I do see special educators leaving the field. It's an impossible job, and it's going to get worse if all these cuts go through.
Meantime, the district maintains each special education student will get the same level of support, and in some cases more. We'll keep you updated on what happens. Christine Pitawanich, KGW News.
Keep sending your questions and comments to the story at kgw.com. Up next, how you can help your... For this week's Hey Help campaign, we're asking you to donate to Hala. They're a mentoring program based in East Portland that connects kids of color with role models who share their culture. This fall, they're planning to open a public charter school in partnership with the Reynolds School District. If you want to donate, just hold your phone's camera up to the QR code that's there on your screen now, or you can go to kgw.com/heyhelp. Well, that's the end of our show. Thanks for watching. But remember, the story, our story, well, that never ends. I'll see you tomorrow.
This is KGW News at